Hey y'all, I'm back again. So I was just sitting here. I realized I just need to take a break from studying right now. So I decided to make another video real quick because there was a topic that I wanted to discuss and I have been wanting to discuss for a while. I just hadn't ever gotten around to it. But what I wanted to talk about was um, for like future nursing students, current nursing students, however you want to put it. There are things that you learn in nursing school, obviously, and then there's a ton of things that you will not learn in nursing school. So I just wanted to go over maybe 6 things, 5 or 6 things of things that nursing school does not teach you. And if you see me looking down, it's because I wrote the stuff down on like a little note card, so I might have to look back at that periodically, just so that I don't miss anything. Um, so the first thing that nursing school does not teach you is time management. That's a big thing, especially if whether you're working at the hospital or you're working at the nursing home. Time management is very important. I personally have never had an issue with time management because I've worked in healthcare for a long time, and I know that certain things have to be done um, in a certain time frame. I'm always the one that, well, not now, but sometimes I dread going to the hospital. But I was always the person that when I worked in clinics to be the first one to arrive, open the doors, set up all the patient rooms, and then I would get started on whatever I needed to get done for the day, whether it was looking at lab results from day before, a couple days before, whatever it was, lab results, looking at imaging reports, look at the schedule for the day, kind of see how many patients we have, making sure that I had everything for their charts, labs, any diagnostic testing that the doctor may have ordered, getting pertinent information ready, just in case, knowing everything about the patient before they come in. But like I said, time management is very important. So I'll give you an example of what I do when I get to the hospital. We'll get shift report, um, and then I go check on my patients. I don't look through the charts first, and there are some nurses that will literally come in 30 minutes early and look through a patient's chart before they even get shift report, and I don't like that, but whatever. But I go and get an eye on my patients just to make sure that they're at baseline, making sure that they're stable still, that nothing happened in the 30, 45 minutes to an hour, from when their nurse went in last time or whatever the case may be. I always make sure I get an eye on my patient, and then I come back and I have a system where I would write down what medications they need for the night, making sure that everything is in the Pyxis, any IVs, any antibiotics that they have to get, fluids. A lot of times I'll come in to work and the nurse on the shift before me will not have replaced their IV fluids. The bag's empty, the machine's beeping, so that's why I go ahead and get an eye on my patients before I start anything else. Um, Second thing besides time management is giving a shift report. That's one thing that nursing school does not teach you how to do. You may overhear other nurses talking about their patients. At the nursing home, it's a little bit different, I know, because basically they just let you know if the patient can swallow their pills whole or if they need to be crushed, and if this person is an Accu-Check, which is a blood sugar check, that kind of thing. But when you're at the hospital, it's a little different. So you kind of have to go through systems, like body systems. Think of it that way. You're going to tell them, um, okay, let's say if I was giving someone shift report, you're going to tell them the patient's name, age, um, what they're being admitted for, what their admitted diagnosis is. Then you're going to go code status, if there are Accu-Checks. When I say code status, I mean like full code or DNR. Um, then you are going to ask about any allergies that they may have, their diet. I necessarily don't need that working night shift because I don't do any meals at night. but it would be information that I would pass on to day shift. Then you go to where they're alert and oriented. If they're alert and oriented times 1, 2, 3, 4, whatever, then you would let the oncoming nurse know if they have any skin issues, any cardiac issues, whether they are on telemetry or not, if they've got any edema, which is swelling, any skin issues. You're gonna also go whether they're continent of bowel and bladder, which means if they can pee or poop on their own, whether they've got a Foley, if that's important, because obviously if they've got a Foley, they're either altered and don't need to get up, or they have fluid retention and they need to have a Foley catheter. You're also gonna want to make sure that you let them know when their last bowel movement was. What else? How they get up ad lib, whether they need assistance with a walker or like a 2-person assist, standby assist, that kind of thing. And what else? I think that's pretty much it as far as basically you're going to go from head to toe as far as what what they need. If they don't need anything and they're what we call walkie-talkie, meaning they can get up, they can ambulate on their own without assistance. They don't need any issues, any help, any assistance with anything. And again, like I mentioned before, you're gonna ask them, as far as their medications, whether it's a patient that may be a possible aspiration risk. You're gonna want to know how they take their meds, if they take them whole, crushed with applesauce, crushed with pudding, cut in half, anything like that as regards to the medication. If they're on precautions, like if it's a COVID patient, you're gonna need to know if they're on precautions for that, or if it's flu or MRSA or whatever the case may be. You're going to need to know all that, and you're going to need to be able to translate that information to the oncoming shift as well. The third thing is charting systems. At the hospital, we've got Epic. We were using Meditech before. I had used Meditech in the past. I have also used Epic in the past, so I was familiar with most of it, but not everybody has used specific certain charting systems or electronic medical records. So that's another thing that they don't teach you in nursing school, and that's to say they don't really have time to teach you all of that, but it would be nice if they were to explain, this is a possibility of this may happen. Some people still have paper charting. I don't know why. I hate paper charting. I would much rather use the computer, but nursing school does not teach you that. Let's see, what's that? 2, 3. Okay, number 4 is how to deal with doctors and possibly other coworkers. Coworker thing is a given. Everybody has to be able to deal with that at any job. But when it comes to how to deal with doctors, example, I work at night. A lot of the times there aren't any doctors there at night, so we have to page them. Some of the doctors can be mean. Some of them can be accommodating. We also have residents that we can contact until certain times, just in case we have an issue that needs immediate attention. But usually we would have to call or text a doctor depending on the urgency of the matter. But let's say if it's a patient that has a low blood pressure, let's say it's 86/60, you rechecked it twice and you did a manual. More than likely, the doctor is going to order a bolus for this patient, which is like a liter of normal saline or lactated ringers or something like that. You're going to give them that and then update the doctor after that bolus is finished to let them know if there was an increase in their blood pressure. If not, then he'll order another one or he'll order something else. But a lot of the times doctors don't want to be bothered, whether they're on call or not. They don't want anybody to text them or ask them anything stupid. So for the most part, if it's something you know, you can go to your charge nurse and your charge nurse can handle that for you. I don't have issues speaking with doctors because, like I said, I worked in healthcare for a long time. I worked with doctors for a long time. I don't care if they give me attitude as long as I know I'm doing my job um, effectively. But yeah, so speaking with doctors. Um, Number 5 is okay, so you know how they always teach us how to do CPR at school. And they show us how to use the AED machine and all that stuff. But nothing in the world can compare to the reality of doing CPR on your patient for the first time. I was probably at my job for maybe 3 or 4 months before I had my first code. I didn't have time to think. You have to just act. So I was the one that was initiating the CPR while everybody else was running around trying to get supplies and the crash cart. But nothing will I lost my word. Nothing will compare to that first compression that you do and you hear their ribs crack. That is just a horrible situation. And then so my feelings on CPR. If me personally, since I know how bad it is, and I don't think I would want anyone to do CPR on me. I know that it could bring me back to life, but the complications that you have after having chest compressions, and then if you're not breathing, obviously they have to intubate you, which means they put a tube down your throat and they bag you, and basically they're breathing, the pump is breathing for you. But nothing can prepare you for the reality of CPR. So just keep that in mind, that it's not like doing it on the dummy. It's not like that at all. Um, the last and final thing, I'm gonna make this quick. I feel like I've been rambling, but I'm giving examples as I go. So, last and final thing, nursing school will not teach you or prepare you for the level of mental and physical exhaustion that you will receive during your shift, after your shift, before your shift, whatever. It can really be mentally and physically exhausting having to do so much for patients, especially if you got somebody that's a total care. You can have 5 or 6 patients at one time. You could have 2 or 3 total care patients. You can have one patient that's getting IV antibiotics every 4 to 6 hours. You can have one patient that can get up and ambulate on their own without any assistance, and they usually don't call you for anything unless they need something for pain or something like that. But it could be very taxing and very stressful, having to do so many different things at one time and still manage to get everything done in a 12-hour period. Yes, you have 12 hours to get it done, but you've got a chart in between that. Charting takes a while, especially if you get an admission. There's another level of charting that has to be done when you get an admission. And then you have to make sure that all the required documentation is complete before the end of your shift. A lot of nurses end up staying late. I know day shift nurses usually end up staying late because during day shift they've got multiple doctors coming in and out. They've got consults. They've got patients going down for tests. They've got meals. They've got to feed these patients every meal. Then they've got to do AccuChecks before every meal. So, but it could still be really, really, really exhausting. Sometimes you think you're not doing your best. Sometimes you could not be. But, there's always like a light at the end of the tunnel. I've had multiple bad days. I'll go into work and I'll think, I just don't want to do this anymore. I'm tired of this. And then you get that one patient that tells you how sweet you are and what good of a nurse you are. And that usually brightens up my day, and then I'm fine like for the rest of the night. But there can be, issues that come along and arise, that you can't really prepare yourself for. You just kind of throw yourself in there. Um, anyway, I think that's pretty much it that I wanted to discuss. If you have any questions about any of that stuff, feel free to comment below. one quick thing about before I forget, the shift report. I download it. You can download or you can create your own shift report sheet so that it's easy for you to write down what you need to know for your shift. There was a website, I think it's called nursing.org. If I can find it, I'll link it down below. But you can pretty much go on like Etsy and look up nurse report sheets. They usually have them catered to specialties. I work on a med-surg floor, so I printed off one that was for med-surg. So I just kind of use that, and that kind of keeps me organized throughout the day. But like I said, nursing school is difficult. It's not easy. Nursing is not easy. But somebody's got to take care of you, right? Well, that's it. This video is a little bit longer than I expected it to be, but at least I got it out. And like I said, just remember to like, comment, and subscribe. Bye.